Dysautonomia is a condition that is widely overlooked, misunderstood, and poorly cared for in today's traditional medical model. When it comes to our kids, we all dream of a life where they are happy, healthy, and thriving. But for hundreds of thousands of families today, when this perplexing condition called dysautonomia sets in, their child begins to suffer daily from debilitating issues ranging from mood disorders, gut problems, chronic pain, muscle weakness, and more. Dysautonomia is also a significant underlying factor in things like autism, ADHD, sensory processing disorder, seizures, POTS, PANS, and PANDAS, all of which are now seen at significantly higher rates than they were just a few years ago. While traditional medicine can sometimes offer symptom relief, many parents often wonder if there is something more that can be done to help get to the true root cause and help their child achieve full recovery and optimal outcomes from dysautonomia and all of its health-related challenges. In this video, we'll explain what dysautonomia is, what causes it to develop, what associated symptoms and health challenges come with it, and how neurologically focused chiropractic care may be the missing link to restoring your child's nervous system balance through cutting-edge new techniques and clinical protocols. For 17-year-old Francesca, health challenges ruled her childhood. Plagued by seizures since the age of 7, then worsening fatigue, anxiety, and eating disorder, and constipation through puberty, her quality of life suffered. Despite constant medical care, doctors had no explanation for why she was experiencing such a multitude of symptoms altogether. It often felt like they were simply treating random issues in isolation versus getting to one real root cause. That was until Francesca's mom learned about dysautonomia from a friend. One trip to a specialized chiropractor changed everything. So let's dive into dysautonomia, starting with understanding what it is. Dysautonomia is when the autonomic nervous system, the master control center managing nearly every organ and system in the body, from digestion and the regulation of inflammation to breathing and blood pressure regulation. When that system isn't working as it should, it's labeled as this condition. When not functioning properly, dysautonomia throws off communication between the brain and the body, manifesting in diverse symptoms that differ based on which organs it impacts. The most common symptoms, such as gut issues, anxiety, heart palpitations, and fatigue, are related to the most commonly affected systems, which are the digestive system, cardiorespiratory system, and the brain. So that's what dysautonomia is. But what causes it? What causes this way of functioning to set up in the body in the first place? While traditional medical doctors and neurologists struggle to properly recognize, effectively treat, and explain what's really causing it, our clinical observations and research review highlight 5 main triggers of dysautonomia. Number 1, being prenatal or maternal distress, such as a high risk or high anxiety pregnancy. This scenario exposes the developing fetal nervous system to excessive stress hormones in utero and may lead to an underdeveloped vagus nerve and parasympathetic nervous system. Baby is wiring their system for life on the outside based on what mom is experiencing. And if that experience is consistently stressful, the development of the baby's nervous system may be influenced. A second culprit that can cause dysautonomia has to do with the transition of baby from being inside mom to being brought into the outside world. Birth interventions like forceps, vacuum extraction, and C-sections can lead to physical injury and trauma that lead to biomechanical misalignments and subluxations in the upper neck and mid-back areas, which then negatively impacts the function of the vagus nerve and parasympathetic nervous system once again. Vagus nerve injury, damage, and dysfunction are without a doubt the leading cause of dysautonomia. If your main method to calm and relax your system is altered, especially at the beginning of life, it's kind of like learning how to drive in a car that doesn't have any brakes. Something not so great is bound to happen. A third contributor is altered development and missed milestones. This may leave the brain and nervous system underdeveloped off track, and less resilient and adaptable later in life. Movement is what drives neurological development. The brain is built through input, and movement is a massive contributor to that early life input. Number four, contributing cause to dysautonomia involves recurrent infections, ongoing gut issues, chronic inflammation, and the overuse of antibiotics and other medication throughout a child's life. If the brain is being constantly flooded with bad input from within the body, it will respond appropriately to those signals with that fight or flight stress response. That's good. Our body should respond to that chaos in an appropriate way. But if that response is repeated over and over, day after day, it's not beneficial to the body when it comes to long-term health, growth, and development. Dr. Bruce Lipton puts it this way: you can't be in growth and protection at the same time. In other words, if we're constantly in a state of protection, we're not going to be growing as we could or should be. And lastly, a fifth trigger for dysautonomia is chronic sensory challenges and anxiety in kids. This can further trigger a continual stress response. If your body is constantly in an aroused, sympathetic fight or flight state, the sensory system heightens. The input to your brain, the input it's receiving, is coming in at an amplified level, making it much easier for the brain to signal a stress response. Inflammation, excessive stress hormones, continued arousal of the nervous system. Again, you can't be in growth and protection at the same time. Over time, these triggers can send the body into a vicious cycle where the overdriven nervous system fails to regulate itself properly, thus resulting in dysautonomia. Once dysautonomia sets in, the patient struggles to properly maintain homeostasis, regulate their nervous system, and adapt to even regular daily stressors and routines. While traditional medicine continues to lag behind in their understanding and proper care for dysautonomia, there is an entire network of specialists called neurologically focused chiropractors who have a deep understanding of dysautonomia and can provide a drug-free clinical approach that addresses the root cause head-on. This unique and cutting-edge approach begins first with a deep dive into the patient's case history to find out if any of those 5 perfect storm risk factors for dysautonomia occurred. From there, we get to the exciting part: our insight neurological scans and heart rate variability technology. These scans can find and detect the presence of neurological dysfunction and dysautonomia at an incredibly advanced and in-depth level, going far beyond what traditional medical testing like blood work, MRIs, or even EEG can reveal. The most important element of these scans is the HRV scan. It's the gold standard for finding dysautonomia and then being able to track and measure positive improvements in autonomic nervous system function as the adjustments begin and care progresses. The doctors in our PX Docs network are trained specifically in caring for dysautonomia without drugs, and they know how to use specialized techniques and clinical protocols that seek to restore balance to the autonomic nervous system, activate the vagus nerve, and over time help the patient regain an incredible quality of life. We're going to jump right in and look at what the HRV plot looks like. This is the summary view. This is what we're looking for. It's showing us a couple of things. One of the things it's looking at is the balance of the autonomic nervous system, the autonomic balance. Is your nervous system at a baseline level operating in a more fight or flight or sympathetically dominant state? And looking at this HRV plot, we can see that not only is it operating more on this fight or flight aspect of the nervous system, when we look at the autonomic activity, you can think of it as your body's battery, your ability to handle stress. It's less than what we want to see it at. We want to see it balanced and high in the green. The healthiest individuals live here with a high, what's called autonomic reserve, just an ability to handle stress. So when we see at a baseline level a person's nervous system operating in this exhausted and yet fight or flight dominant state, it's showing us varying levels of dysautonomia. To learn more about dysautonomia and how neurologically focused chiropractic care can be the missing key to drug-free relief and neurological restoration, comment below, send us a DM, or see the link in our bio to learn more. Thanks for watching, be blessed, and have a wonderful day.